Welcome to Johnson Medical Associates in the Hyperbaric Centers of Texas. I am Dr. Alfred Johnson, the founding physician. I am an internist by training, fellowship trained in environmental medicine, and directed a hospital-based environmental unit for 15 years. This broad background in medical experience has educated me in evaluating and treating multiple body systems, complaints, and illnesses looking for the underlying cause. These body areas involve nervous system, lungs, heart, bowel, digestion, endocrine, musculoskeletal, and allergy and immune systems. As an osteopathic medical student, I was taught from day one that the body is an integrated organism necessitating a whole body approach to health and wellness. As a physician, to be effective in diagnosing and treatment, I use a variety of assessment tools, including blood analysis, cultures, radiology scans, allergy testing, neurological and cognitive testing, including QEEG. Treatment approaches include medication, nutritional support, allergy treatment, physical therapy, massage, hyperbaric oxygen treatment, counseling, education of the disease process for the patient, biofeedback, and neurofeedback. Today, I'd like to discuss the long haul syndrome that many people have experienced from having COVID infections. First, let's review what happens when you have COVID infection. You have initially exposure to the virus, you get viral proliferation, which is the actual doubling, tripling the viral load in your body. It creates cytokine injury, which is in some cases the pneumonia in the original infection. Now in the later variants, it's more of a sinus cough, inflammatory throat congestion, and then thrombosis occurred, causing damage to the tissues, whether it was heart or lungs or brain. The post-COVID syndrome is defined as symptoms being present for more than 3 months. These symptoms may involve the lungs with shortness of breath, difficulty in breathing, allergy symptoms where you react to foods, gastrointestinal problems with bloating and gas, lack of energy from the mitochondrial system, heart irregularities, chest pain, and nervous system difficulties with brain fog, headaches, dizziness, imbalance, and in some cases, activation of underlying disease processes occur where you had a slight allergy to food or an outdoor pollen. That is now much worse. A recent study by Helms in 2020 showed that neurological symptoms were quite prevalent after COVID infections. And he looked at 58 patients, 84% had neurological symptoms at the time of discharge from the hospital. Brainwave studies showed disorganization of the brain waves, and the MRI showed hypoperfusion or decreased blood flow in the frontal temporal lobe regions. This is a manifestation and proof of brain inflammatory process that COVID caused. This is an example of a QEEG. The normal brain is all tan. The blue lines are underactivity, and the red lines are hyperactivity. My COVID recovery treatment program involves 3 steps: repair the damaged tissues, retrain the brain, and then rethink the treatment process. Repairing the body tissue is the first step in recovery. Normal repair takes months to years. With hyperbaric oxygen, repair occurs much more rapidly as a person is placed in a chamber under pressure, breathing 100% oxygen, which increases delivery of the oxygen to the tissues by 10 to 15 times. When recovery occurs, then retraining can take place with retraining the brain with neurofeedback, physical exercise of the body, breathing exercises with the lungs, nutrients and hormones where appropriate. Rethinking the process then takes place to decide what other additional activities need to continue to help recovery, whether it's activities of daily living, increasing physical activity, gradually increasing work schedules, changing of diet, and then assessing lifestyles to reduce stress. Hyperbaric oxygen therapy has been frequently discussed in the treatment of post-COVID syndrome. Recently, effectiveness was confirmed by a report in the Scientific Reports, July 12, 2022, published from an Israeli study that used 73 patients, 40 consecutive sessions of hyperbaric oxygen therapy involving 73 patients. Significant improvement in brain MRI perfusion and microstructural changes occurred. Their conclusion was that hyperbaric oxygen therapy can induce neuroplasticity, improve cognitive and psychiatric fatigue, sleep, and pain symptoms of patients suffering from post-COVID condition. Hyperbaric oxygen therapy's beneficial effect may be attributed to increased brain perfusion, that means blood flow to the brain, oxygen to the brain, and neuroplasticity, which is healing of the brain in regions associated with cognitive and emotional roles. This is an example of a hyperbaric chamber, hard-sided chamber, which will go up to 3 atmospheres to enhance the healing process. Thank you for listening to my process in approaching the long-haul COVID syndrome. It is important that each body system is addressed, considered as part of the problem, and then appropriate specific treatment takes place.